Welcome to UNSW's Museum of Human Disease. Today, we will be looking at lung cancer, the fifth most commonly diagnosed cancer in Australia. It is responsible for almost 1 in 5 cancer deaths in Australia, and it is estimated that a person has a 3% risk of dying from lung cancer by the age of 85. Due to the great impact this cancer has on society, it is extremely important to know about the major lung cancer types as well as their symptoms, risk factors, and complications. Before we look at this tour, let us briefly look also into the structure of the lungs. The lungs are two sponge-like organs in our chest. The right lung has 3 sections or lobes compared to the left lung's 2 lobes as seen in this image. When we breathe in, air enters through our mouth or nose and goes into the lung via the trachea, commonly known as the windpipe. The trachea divides into tubes called bronchi, which enter the lung as the right and left main stem bronchus and divide into smaller bronchi. Just a note here that bronchi refers to the plural form of these airways, whereas bronchus is the singular form. These bronchi then further divide to form smaller branches called bronchioles. At the end of the bronchioles are tiny air sacs called alveoli, which enable the oxygen and carbon dioxide transfer from the blood. Lung cancers in general usually start in the cells lining the bronchi and parts of the lungs such as the bronchioles or alveoli. Now that we have looked at the lungs, let's explore what lung cancer is. As its name suggests, it is the cancer of the lungs, particularly affecting the cells of the various parts of the lungs that we have explored earlier. Like other cancers, lung cancer is the result of the uncontrolled growth and multiplication of the cells in the lungs. Over time, this abnormal growth becomes a larger mass and starts to invade functional parts of the lungs, causing various symptoms that we will be looking at today. This abnormal cluster of cells is referred to as a tumor, as shown in this image. They are referred to as malignant, which means that if left untreated, they can spread throughout the body. Do note that the specimens we will be looking at today are that of primary lung cancer, or a tumor that starts in the lung. There are also secondary lung cancers when the tumor spreads through the blood from another part of the body, but that will not be today's focus. Now let's look at some types of lung cancer. The 2 main types are non-small cell carcinoma and small cell carcinoma, which make up 85% and 15% of all lung cancers. Note that carcinoma is simply another way of referring to cancer. You may be wondering why they are called small cell and non-small cell carcinoma. Well, the naming is dependent on the histology or how the cells look like under the microscope, as depicted by this schematic here. Non-small cell carcinoma can be further divided into adenocarcinoma, squamous cell carcinoma, and large cell carcinoma, which are all named after the type of cells involved in the cancer. Among them, adenocarcinoma is the most common, followed by squamous cell carcinoma. These non-small cell carcinoma subtypes have similar treatments and outlook. However, small cell carcinoma is more aggressive, and 70% of people would have cancer that has already spread. This shows the importance of noticing symptoms early and going to your doctor. The first specimen we will be looking at is specimen 1017. This is an example of one of the non-small cell cancer types, that is adenocarcinoma. On the left of your screen is the right upper lobe of a 40-year-old woman who complained of an early morning hacking cough that has been going on for quite some time, as well as some weight loss. Hacking cough here refers to a loud and dry cough whereby the person does not actually cough out anything. On the edges of this specimen, a scar is visible, and this is possibly due to infection of the lungs many years ago. However, the more pressing matter here is the tumor, seen arising from the scar in the central area. It extends into the curve created by branching of the main bronchus. This is an example of lung adenocarcinoma, which is the cancer of the cells that normally secrete mucus and is usually found on the outer edges of the lungs. However, it can also be found more centrally, as in this woman. This type of cancer is more common in women and younger people aged 20 to 46 years old. In fact, it is also the most common lung cancer in non-smokers. What are some symptoms that the person will present with? Symptoms include coughing, which is because of obstruction of the airways by the tumor, which causes irritation. It may also be difficult to breathe due to the tumor blocking the airways. Blockage of airways may also result in wheezing when there is a high-pitched whistling sound when the person is breathing out. Other symptoms include chest pain due to the tumor spreading to the lining of the lungs, and this pain is worsened by breathing and coughing. The person may also notice that his voice has changed into a more hoarse voice, and in addition to that, more generalized symptoms include unexplained weight loss, loss of appetite, and excessive tiredness. Symptoms may appear a long time after the tumor, and thus it is important to note early symptoms such as tiredness, subtle shortness of breath, or upper back and chest pain. Severe coughing up of blood usually manifests in the later stages and is because of the tumor invading into surrounding blood vessels, causing this leakage of blood. Let us now look at some risk factors for lung adenocarcinoma. Note that a risk factor does not confirm that you have lung cancer, but rather increases the chance of you having one. There is a strong association to previous smoking of tobacco, but surprisingly, as mentioned earlier, lung adenocarcinoma is also the most common cancer in non-smokers. Exposure to chemicals is also a risk factor. In fact, carbon and silica was found in the lungs of the patients we saw earlier, possibly because she was living near a factory and therefore was being continually exposed to fumes without her knowing. Other risk factors include secondhand smoke, cancer running in the family, as indicated by family history, or possibly some genetic mutations. Great progress has been made in understanding these genetic mutations, which are basically random changes in the DNA, and many treatment approaches targeted at these mutations have been approved recently. Lung adenocarcinoma is often first detected by X-rays when abnormalities are noticed, although sometimes a regular chest X-ray may not detect anything of significance. Hence, more sensitive methods such as CT scans, MRI, and PET scans are used because they are more accurate, and examples are shown here. Bronchoscopy can also be done where a scope is inserted into the throat for visual examination of the airways, as you can see on the bottom left. Sometimes, a biopsy can also be done whereby lung tissue or lung cells are taken out to be looked at under the microscope. After determining that the diagnosis is adenocarcinoma, doctors will do this thing called staging. Staging is a way of describing where the cancer is located, if it has spread, and whether it is affecting other parts of the body. This is done using a TNM system, as indicated here, which stands for tumor T, node N as in lymph node, and metastasis M as in spread to other organs. The size of tumor and spread to lymph nodes and other organs is determined before staging the cancer. Lymph nodes are found all around the body and are small oval-shaped structures, part of the lymphatic system that fights foreign invaders and viruses. When the cancer cells break away from the tumor and travel to other organs via the lymphatic system, they can end up in these lymph nodes. Stages range from stage 0, where the tumor is confined to the lungs, to stage 4, whereby there is extensive spread of the tumor. Sometimes, bone scans can be done to see if the bones have been invaded by the tumor as well. Let's now look at the natural progression and complications of this disease. Usually, the symptoms discussed earlier may last for 3 weeks to 3 months before any medical attention is actually sought by the person. In advanced stages, spread to other organs such as the spine and the brain may cause leg weakness, bladder dysfunction, seizures, and confusion. Complications can also arise due to the physical presence of the tumor itself. For example, due to the tumor blocking the airways, secretions may start to accumulate behind the blockage, and this increases the risk of infection, also known as pneumonia, which is indicated in red here. Due to such complications, it is important to identify symptoms early. The second specimen we will be looking at is specimen 1359. This is an example of squamous cell carcinoma, another type of non-small cell carcinoma. On the left of your screen is the right lung of a 59-year-old man who complained of worsening shortness of breath, coughing of blood, and weight loss, which are all characteristic symptoms of lung cancer, as we have explored earlier. X-rays revealed a tumor in his airways, which was confirmed by bronchoscopy and biopsy. An irregular light gray tumor arising from the right bronchus, which is invading the lower part of the trachea and surrounding lung, can be seen in the close-up view. Due to the extension of the tumor, it is actually compressing on some of the blood vessels, interfering with the gas exchange and thus contributing to that shortness of breath this person experienced. This has also resulted in some lung tissue not receiving adequate blood supply and dying, resulting in infarcts on the tip of the lungs, denoted by the red areas. Additionally, the lung surface is also markedly thickened. Squamous cell carcinoma is the most common type of lung cancer in men and is more common in men than women. Majority of patients are between 55 to 60 years old. It typically grows more slowly than other lung cancer types. As suggested by the name, this form of cancer, or carcinoma, is the cancer of thin flat cells, also known as squamous cells, which line the airways, often in the central parts of the lung or in the main bronchi. Symptoms are similar to adenocarcinoma and include chest pain, shortness of breath due to the tumor obstruction or fluid buildup around the lungs, wheezing, coughing up of mucus and blood, as well as swelling of the neck and face areas. So why does this swelling occur? Swelling occurs when the cancer spreads to lymph nodes, which, as discussed earlier, are located all around the body and thus manifests as swelling visibly. Other general symptoms include extreme tiredness, loss of appetite, and weight loss. Risk factors are similar to that of adenocarcinoma and include tobacco smoking, marijuana, and exposure to minerals such as asbestos and a history of cancer running in the family. Note that asbestos is a mineral released by factories manufacturing asbestos-containing products, and this dust can be inhaled by people living nearby. Although the use of asbestos in building materials has been banned across Australia since 2004, there is still this asbestos chemical in some older buildings and fences. Tests to confirm diagnosis include the methods discussed earlier, such as X-rays, CT scans, bronchoscopy, and biopsy. If the tumor grows to a large size, a chest X-ray or CT scan may actually even detect a cavity in the lung. A cavity is a gas or fluid-filled space within a tumor mass and is a classic sign of squamous cell carcinoma. Additionally, a method more useful for squamous cell carcinoma compared to adenocarcinoma is something we call sputum cytology, indicated by the red font, whereby coughed up mucus is examined for cancerous cells. This is shown on the bottom left image. This is effective given that cancerous cells are more readily dislodged from the large airways, allowing them to be coughed out into a dish as shown here. Once the diagnosis is confirmed, the cancer is staged using the TNM system from stage 0 to stage 4 depending on the severity as shown on the right. Majority of patients initially present with no symptoms. If left untreated, the cancer can spread to distant areas such as the brain and bones, leading to complications such as headache, bone pain, and limb weakness or numbness. The tumor can also invade into nerves, causing shoulder pain. Also, the tumor can invade into the nervous system, leading to something called Horner's syndrome, which presents clinically as decreased sweating and droopy eyelids as shown in this image. High calcium levels due to hormone secretions triggered by this tumor can result in muscle weakness and cramps. This can also be due to the tumor spreading to the bone and causing calcium release from the bone itself. Now that we have looked at specimens of non-small cell carcinoma, let's look at small cell carcinoma. As discussed at the start of this tour, this is the less common type of lung cancer that is, however, more aggressive. Small cell carcinoma is also called oat cell carcinoma because the cells look like oats grains under the microscope as shown on the image on the bottom right of your screen. Let me now draw your attention to specimen 507. On the center of your screen, you can see the lung with a small grayish tumor arising from a large bronchus in the upper lobe of the lung. Furthermore, there are multiple scattered small circular nodules present on the lung surface, as shown on the left image. These are in fact examples of cancer spreading which has even reached the liver with its nodular appearance on the left of your screen. Small cell carcinoma is an aggressive cancer that has faster spread and growth rate than non-small cell carcinoma. As such, it is quite common for tumor deposits to be found in other organs post-diagnosis. It is said that only 5 to 10% of people survive 5 years after diagnosis. The specimen here is taken from a 50-year-old woman admitted after experiencing convulsions. A chest X-ray revealed tumor in the lung, and further examination revealed an enlarged liver with multiple secondary deposits of tumor. Symptoms experienced include that typical of lung cancer, such as chest pain, worsening cough with or without blood, difficulty breathing, and wheezing, in addition to generalized symptoms such as weight loss, tiredness, and loss of appetite. Symptoms appear fairly suddenly and severely, usually with a cancer that has been going on for a few months. Risk factors are similar to that for other lung cancer types and include smoking, which is the biggest factor, exposure to asbestos dust or radiation from factories, air pollution, history of family cancer, as well as older age. Diagnosis is done after an initial physical exam and health history is taken, whereby the patient is checked for signs of disease and asked about health habits such as smoking. Since small cell cancer is an aggressive type quickly spreading to other organs, blood and urine tests are also pivotal. Other methods talked about earlier, such as X-rays, CT scans, sputum examination, bronchoscopy, and biopsy also can be done. Following diagnosis, doctors will stage the cancer. Unlike the specimens and the cancers we have looked at previously, a two-stage system in fact is used to divide the cancer into limited and extensive stage for treatment purposes. Limited stage cancer is found in only 1 out of 3 people and refers to cancer confined to an area small enough that it can be treated by radiation therapy combined with anti-cancer drugs. On the other hand, extensive stage refers to cancer spread extensively throughout the lung or to other organs such as the liver, as we saw in our specimen. For extensive stage, chemotherapy alone is likely to be a better option to control and not cure the cancer. Note that chemotherapy here refers to the use of anti-cancer drugs. One of the factors used to determine which stage is the involvement of lymph nodes. Let me once again draw you to an image that we saw earlier on the right. Cancer which has spread to lymph nodes on the same side is usually classified as limited stage, whereas cancer spread to lymph nodes on the other side of the chest is usually classified as extensive stage. Due to its aggressive nature, there are various complications arising from small cell carcinoma. Because small cell carcinoma is a type of neuroendocrine tumor, the neuroendocrine cells that form part of the lining of the airways experience this uncontrolled growth and multiply. Neuroendocrine here refers to cells interacting with the nervous system, neuro, and the hormonal system, endocrine. Therefore, one possible complication is syndrome of inappropriate antidiuretic hormone secretion, abbreviated as SIADH, and this involves low sodium levels in the body. This will initially present as vomiting with a more severe fall in sodium leading to headache, lethargy, and seizures due to water moving into the cells of the brain. Occasionally, Cushing syndrome can occur where the tumor triggers production of hormones that causes extra fat to build up on the sides of the face. This results in a swollen and rounded face commonly referred to as a moon face appearance. This was observed in the woman whose lung we saw earlier, and after physical and mental deterioration, she unfortunately died 5 weeks after onset of her symptoms. Hence, the destructive nature of small cell carcinoma. The final specimen we will be looking at today is specimen 608, which depicts once again a small cell carcinoma tumor and nicely summarizes the different features we discussed earlier. This is the right lung, and we can see how a centrally placed carcinoma is infiltrating the region of the right main bronchus. Also note that the middle and lower lobes towards the bottom of the specimen on the left image look kind of collapsed, indicating some kind of disease that is occurring, which in this case is cancer. This woman complained of bone pain in her chest and shoulders, as well as a loss of 6 kilograms of weight over the past 8 weeks, which are characteristic symptoms of extensive stage small cell carcinoma. Additionally, 1 month before her death, she was paralyzed on the right side below her ribs. At autopsy, it was found that the tumor had spread to her lymph nodes, liver, pancreas, and spine, and thus manifesting as the aforementioned symptoms that I've talked about. One of the complications, as we saw earlier in another specimen, is infection of the lungs, also known as pneumonia. In fact, this woman has developed bronchopneumonia, which presents with a scattered appearance as shown by the black dots in the upper lobe region on the left image. Microscopically, what happens here is that the tiny air sacs, also known as the alveoli, would have been infected and inflamed, leading to symptoms such as breathing difficulties as well as inducing a fever. In summary, today we looked at small cell and non-small cell carcinoma, the two main types of primary lung cancers. Due to its destructive impacts on our society, it is important to partake in preventable behaviors that reduce the risk of cancer. The main one is smoking, which increases lung cancer risk by 10 times compared to non-smokers. The earlier a person starts smoking and the longer he or she smokes, the greater is the risk. In fact, it has even been shown that giving up smoking reduces the risk of lung cancer because damaged lung cells start to repair, reducing the risk of lung cancer to a level similar to non-smokers. Additionally, if you notice any of the symptoms that we have talked about, with the most pertinent one being coughing up blood out of the blue, please visit your doctor to allow for early detection before the disease aggravates. I hope that today's tour was useful and educational and that you learned more about lung cancer. Lastly, I would like to show my appreciation to the people who generously opted to donate their lungs for your viewing today. Thank you for taking part in the tour today and have a great day ahead.